Project Veritas is out here again, exposing just the outright corruption of the Biden administration, the FDA, all of these nameless, faceless, 3-4 letter organizations, and doing the real journalistic work that, the rest of the alphabet agencies just really gave up on. So, what have they been dropping here over the past couple of days? On Tuesday, they dropped the first of a multi-part series. Okay, there's 2 parts out so far, and depending on what details come out after this, we might be doing a follow-up on it. But what's been out here so far? It's been pretty damning, and it's worth taking a look at. FDA Executive Officer on hidden camera reveals future COVID policy. Which COVID policy are we talking about here? Well, the one that comes from good old Uncle Joe. You know, the one that he keeps on trying to push. I want everybody vaccinated. And he's going to find whatever institution, organization, whatever he can find in order to make it a possibility. He just keeps failing all along the way. But what is he ultimately trying to push? Well, what does this FDA executive say? Biden wants to inoculate as many people as possible. Oh, that's a laudable goal, I guess. And have to get an annual shot. Oh, wow. If that's not very good, but it doesn't necessarily seem out of the realm of possibility. Just what exactly does he have to say? And who is this guy anyways? FDA Executive Officer Christopher Cole. You'll have to get an annual goof shot. I mean, it hasn't been formally announced yet because they don't want to be like riling everybody up. Yeah, I'd say so, but if that doesn't, this might. Cole on plans to approve vaccine for toddlers for the under 5 crowd, which, what exactly is their risk rate? Don't look at it, don't question it. Safe and effective regardless. They're not going to, approve emergency use authorization for children 5 years old or less. Pharmaceutical companies, there is a money incentive for Pfizer and the drug companies to promote additional vaccinations. No shit. Why do you think they keep pushing this stuff? Just always follow the money. That's why Trudeau's going after the money. And that's why everybody's been able to properly forecast out. If you've been paying attention to the vaccination push, that's why they just wanted to push as many boosters as possible, because they get paid a lot of fucking money and the receipts are starting to come in. Like it says here, it'll be recurring fountain of revenue. It might not be that much initially, but it'll be recurring, a steady flow of income. If they can get every person required to an annual vaccine, that is a recurring return of money going into their company. FDA Executive Officer Christopher Cole inadvertently revealed that his agency will eventually announce that annual COVID-19 vaccinations will become policy. All right, well, this is all speculation and what one man says, so what does he know? Cole is an executive officer heading up the agency's countermeasures initiatives, which plays a critical role in ensuring that drugs, vaccines, and other measures to counter infectious diseases and viruses are safe. Oh, well, see, it's going to be safe and effective. What's your concern over it? It's safe and effective. Just fucking take the shot, bigot. He made the revelations on a hidden camera to an undercover Project Veritas reporter, which, again, okay, you just give a little bit of booze to these people, and every fucking time that there is a drop of information from Project Veritas, they always have just a little glass off to the side and they just fucking spill the beans. I don't know what's wrong with these folks. Cole indicates that annual COVID-19 shots isn't probable but certain. When pushed on how he knows an annual shot will become policy, Cole states that just from everything I've heard, the FDA are going to not approve it. Double negatives. How delightful. The footage, which is one part of a 2-part series on the FDA. Oh, okay. I thought it would be more than that. Normally, it's like a multi-part series that they release on this. So I guess we got everything in totality. That's cool. As contains sound bites from Cole about a financial incentives pharmaceutical companies like Pfizer get from vaccine approved for annual usage. It seems pretty obvious, but for posterity's sake, it'll be a recurring fountain of revenue, Cole said in the hidden camera footage. It might not be that much initially, but it'll be recurring. If they can get every person required at an annual vaccine, that will be recurring return of money going into their company. Perhaps the most exploitative part of the footage is the moment when Cole brazenly, don't get brazen with me, talks about the impact that an emergency use authorization has on overcoming the regulatory concerns of mandating vaccines on children. They're all approved under an emergency just because it's not as impactful as some of the other approvals. Cole said when asked if he thought there was really an emergency for kids, emergencies. I don't know whatever you mean. What emergency could you be referring to? Cole, who claims his role with the FDA is to ensure the agency uses framework of safety, security, and effectiveness as part of its preparedness and response protocols, specifically cited concerns over long-term effects, especially with someone younger. I don't know what he could necessarily mean, but just a non sequitur right there, of course. What about part 2? Part 2 just dropped yesterday, and many people have had the opportunity to take a look at this. What else did he have to say? Well, if he's thinking that boosters are going to get mandated annually, which is, again, doesn't seem all that insane. Still not for it. Definitely would be against it if it does happen. What does he point out? Well, guess what? This is just a big old money push, by the way. FDA Executive Officer exposes close ties between agency and pharmaceutical companies. Almost $1 billion a year going into FDA's budget from the people we regulate. Executive Officer Cole, the drug companies, the food companies, the vaccine companies, so they pay us hundreds of millions of dollars a year to hire and keep the reviewers to approve their products. FDA fees specifically, Congress approved user fees for the FDA. Basically, we charge the industry millions of dollars in order to hire more drug reviewers and vaccine reviewers, which will speed up the approval process. And so they, pharmaceutical companies, make more money. Why is this important? Just take a look at the stock portfolio of a lot of elected members of Congress. Just for proof of concept on this, the FDA toned down their impact, their user fees on their operations because they know they're dependent on drug companies and the vaccine companies and these other companies for their agency to operate. Yeah, big pharma basically drives most of legacy media and all of the big lettered agencies. That's where all the money comes from. If you dig down deep enough, that's normally where the buck ends up ultimately stopping. Cole on blowing the whistle. There's not an incentive to speak out in government, surprisingly. You wouldn't think there would be, but there's not. It's just, it's better just not to say anything and just ignore it. Project Veritas published part 2 of its series on the FDA on Wednesday night, which featured FDA Executive Officer Christopher Cole speaking about the inner workings of the agency, including the FDA's conflict of interest, overspending, and why it's hard for those within the agency to speak out on such abuses. In the footage, Cole talks about the impact the pharmaceutical companies have on the agencies, including the process of approving drugs. A long time ago, Congress approved user fees for the FDA. Basically, we charge the industry millions of dollars in order to hire more drug reviewers and vaccine reviewers, which will speed up the approval process so they make more money. Very fascinating. Became so much of a growth industry that pulling back on any of this, it's going to cost a lot of people a lot of money. So we're just going to have to keep on, doing our medical research that's out there. If you ever want kind of a black pill on why cancer's never ever going to get cured, why there's never ever going to be a magic pill to fix diabetes or heart disease, there you go. He then reveals the FDA tones down the impact that these user fees have on the agency's operations because they're dependent on drug companies and the vaccine companies and the other companies for their agencies to operate. Because if they don't have any new drugs, if they don't have any new products to review, they're relevant and they'd end up working themselves out of a job. That's always why government projects take for fucking ever to finish. But they always magically seem to wrap up whenever a new contract shows up. Incendiary footage, which features Cole talking about the additional money the FDA brings in gets banked to be spent on whatever you can, whether it's right or wrong. Also features Cole discussing reasons why it's difficult for anyone in government to speak out against the practices he sees as probably excessive. No shit. I don't think there's enough people saying they're like, look, that's fine, but that's not right. So we're not going to charge that. You don't want to be that person. You're not going to have a long shelf life in the agency if you're that person. Exactly. Just keep your head down. Your checks are always going to show up. Just cash your fucking paycheck, bigot. There's not an incentive to speak out in government, surprisingly. You wouldn't think there would be. There's not. Oh, you think there would be. Sorry, but there isn't. No shit. Better just to not say anything and just ignore it. The whistleblower, well, it's high-profile whistleblower statutes and everything. That's kind of ridiculous, Cole said before adding, it's better you just stay quiet and accept. Cole's LinkedIn page links him as the executive officer within the agency's countermeasures initiative, which plays a critical role in ensuring that drugs, vaccines, and other measures and to counter infectious diseases and viruses are safe. He made these revelations on a hidden camera to an undercover Project Veritas reporter. Well, you'd think after a couple of days of these rather damning hidden camera admissions, which depending on when or where these were filmed, if it was a one-party state, they're totally fine being on the record. And this is, of course, just the ramblings of one drunken asshole. Theoretically, that's the way that FDA would spin it. They've come out and they've made a statement. You might have seen it if you were doing some extracurricular reading as well. The FDA says the executive who said vaccines will be annual doesn't work on shots. But does he work for the FDA? Does he work in the specific areas where he would be talking about policy? He doesn't work on the vaccine, though. Oh, okay, cool. The Food and Drug Administration has said the purported executive caught on video saying COVID boosters would be an annual requirement, doesn't work on vaccine matters, and does not represent the views of the agency. Okay, cool. Does he work closely with the government? Does he do that? Is he involved with regulating and financial flow? Does he do any of that specifically? Oh, okay. Was he talking about more than just simply the vaccine as well in that first video where he just admitted that a future policy is coming if people don't pay attention? Oh, just saying. Project Veritas released a report Wednesday with edited video snippets. Again, this is every fucking time they point to this. Oh, Project Veritas edited it. Yeah, but you just read the rest of their statement, and you saying that something's edited doesn't mean that the context is removed. It's just edited for ease of viewing. But yeah, no, at least to see... They released these edited video snippets from at least 2 secretly recorded video conversations in January and February with Christopher Cole, the FDA's executive officers for its Medical Countermeasures Initiative. We need not go over this again, but according to an FDA spokesman, the person purportedly in the video does not work on vaccine matters and does not represent the views of the FDA, nor does he speak on behalf of the agency. We know. How many times does Project Veritas make these videos, okay, find these claims, and then whatever agency these people come from, okay, when he exposed not that long ago, CNN doing some shady shit, now take a look at what shambles they're in based on some of the reporting that Project Veritas was doing. I'm going to say, don't know for sure if there's any validity to these claims, but if this guy's a high-ranking official, okay, he's working on medical countermeasures initiatives, whatever specifically that means, there's got to be some truth to that. And the fact that he's just pointing out that cash flow and you just keep your fucking mouth shut and you cash that check, he's got something going on, okay? And where this goes from here, we might not know tomorrow. We might not know at the beginning of next week, but we'll eventually figure it out. And we'll see if this puts a kibosh on any further coup restrictions going forward. But until then, guys, I thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.